Hi, everybody. I'm here with Shiva Bidar Sielaff. Am I saying that correctly?
Sielaff.
Very good. The Vice President and Chief Diversity Officer of UW Health and the Associate Dean for Diversity and Equity Transformation at University of Wisconsin School of Medicine and Public Health. She is another one of our founders who's here to share a little bit with us today about what she feels are some of the important strides that our profession has made from those early days up till today. Thank you so much for joining us today, Shiva.
Thank you so much for having me. What an exciting time to celebrate everything that we've done as a profession. Now, I was reflecting back as a founding member, well, founding before even founding, like some of us were there before the National Council on Interpreters in Healthcare existed. So we really did found the National Council on Interpreters in Healthcare and on interpreting in healthcare. And so really we go way back. And I'm just in awe as I reflect about how far we've come. Really, honestly, in those early days, there was just, first of all, just so few of us doing this work, right? And it was a collective. It was those of us who were actually interpreters, those of us who were advocates for immigrants, refugees, language access. There were doctors. There were, it was like really a multidisciplinary group of people coming together to even just start thinking about how do we do this? How do we do this better? But it was like, maybe 20, 25 of us that would regularly be talking across the country. And now there is thousands of us engaged in this work, right? We're a workforce of interpreters everywhere. And the conversation and the growth of the profession really is amazing to me to have watched. And so, as I think about the strides we've made as a profession, so first thing back in those days, our first conversation was, what's the role of an interpreter in healthcare? What do interpreters even do in healthcare? And there was like this divergent, like perspectives, right? That went from everywhere from like you really were what we now actually in healthcare call like community health workers. In those days, we didn't have these terms, and now we have like community health workers to social worker to anything in between. And so now we've made strides in having a code of ethics and a standard of practice. I'm forever grateful to have been part of the development of the National Code of Ethics and the National Standards of Practice. That work was the process of getting to those documents and doing that work was some of the most wonderful and thoughtful times in my life, because there was such a depth of discussion and of like really trying to understand how we could move our profession as healthcare interpreters, but really move the needle in making sure that limited English proficient individuals had access to the appropriate communication in healthcare. So, strides. We now, have those documents. We've had them now for a long time. Even though at that time we kept saying, oh, it's taking too long to get this developed. And now I reflect back, I'm like, it actually didn't take that long. And then we moved from there to have national certification. That was really when we started this discussion that led to the founding of the National Council. That was a pipe dream. Like the idea that we would even have the possibility of national certification for interpreters working in healthcare was really such a remote consideration. And to think about being where we are today, where we have national certification for medical interpreters, and having been part of also founding CCHI as kind of moving from one to the other, because it was a natural kind of process, right? I just feel like so happy. And then talk about strides. So, interpreter services reports to my area these days in healthcare environment that I live in every day. And I'm I've always said I will never let go. I came from being a frontline interpreter, medical interpreter, from having been involved in the field of medical interpreting for so long, and language access is near and dear to my heart. So wherever, it's always followed my different roles within UW Health. And so here I am in my hallway with all our staff interpreters, and just the pride of knowing that on their badge, it says CHI. The whole walk, and they come every day and they walk around and they say, yeah, so I'm a CHI. I went, and they're like, it's amazing to be working at an organization where all of our interpreters are nationally certified. Whether they're contractors or whether they're staff interpreters, all our in-person interpreters here at UW Health have to be nationally certified. So I wouldn't have dreamed when I started as an interpreter, and then when I was an interpreter manager, to be able to do this. It gives me such a peace of mind to know that we now have these standards and this certification, and that the people that we are trusting to communicate with our limited English proficient patients have demonstrated their qualification. Before that, when, back when I started here in 1997, 1998, I would literally, there were days in which I would not be able to sleep, because I was like, how can I be sure that that interpreter is actually interpreting everything appropriately and correctly? I have no way that I am able to check their qualifications. It would keep me awake. And now it's that peace of mind, because I know all of our interpreters have met the highest standard that we have in our profession with national certification. And then I would say the other area where we've made huge strides is with regulatory requirements, right? Back when we started, again, there was not very clear regulatory requirements, such as the Joint Commission standards to provide language access in healthcare. And so now we are at a place where we have certainly much clearer language in regulatory requirements about the need to have qualified bilingual staff and qualified interpreters in healthcare settings. So that has also helped propel, I think, our ability to focus and center the needs of our limited English proficient patients and families in great ways across the country.
So awesome, Shiva, to think of where it was and where it is now, and know that you had a hand in helping get us to this point. And I was also struck by your remark of how getting together with a group of talented people with passion and intellectual depth was some of the most exciting time in your life. What a special thing to be a part of. And thank you so much for your contributions, because we wouldn't be here now if it weren't for what had been done in the past. Thank you so much.
Thank you. This is exciting. Let's celebrate and let's keep going as the great profession that we are of healthcare interpreters. Thank you.
Bye, everybody.